Let me talk to you about risk factors. Well, we started out and have been talking pretty consistently on this channel about risk factors that can lead to common problems like high blood pressure, diabetes, and obesity. Not surprisingly, the risk factors that can lead to stroke are very similar. In many cases, strokes can be as a result of the previous medical conditions that I just mentioned. Hypertension is a major risk factor for strokes and cerebral vascular disease. The things that you can do to help prevent hypertension or help make sure that your hypertension is well managed are the same things that you need to do to prevent yourself from having a stroke, particularly if you already have a diagnosis of hypertension. That's eating a diet that's low in sodium and processed foods, making sure you're getting regular daily exercise, particularly aerobic exercise in the forms of walking, bike riding, jogging if you must, swimming, those kind of things that help dilate open the blood vessels and bring that blood pressure down. Number two, diabetes. Diabetes is another big risk factor for stroke. Diabetes, like hypertension, over time causes damage to the lining of the blood vessels. That leads to blockage of the blood vessels. And depending on where that blockage occurs, determines what organ damage occurs. If it happens in your brain or even in the blood vessels that lead to your brain, a stroke can ensue. So you need to make sure that you're managing your diabetes and decreasing the risk factors of diabetes being out of control. Once again, diet, exercise, drinking plenty of fluids, and making sure you're getting plenty of sleep at night. And then finally, tobacco use. If you smoke, you gotta quit. If you don't smoke, you should never start. If you're around people who smoke, you need to remove yourself from that environment because secondhand smoke exposure can be just as bad and in some cases even worse than smoking yourself. Because when someone smokes, they smoke through a filter in most cases. When you're breathing someone else's cigarette smoke, there's no filter. So you're getting the straight nicotine and all the toxins that come along with cigarette smoke directly into your respiratory system. Well, how does that increase your risk for stroke? Well, one of the components of tobacco is nicotine. Nicotine is a stimulant. And as a result, when you inhale nicotine, it causes the blood vessels in your body to constrict. That which used to be of this caliber, when you take a hit of a cigarette or inhale secondhand smoke, it narrows. If you've already developed some early atherosclerosis or narrowing of a blood vessel, and then you constrict that already narrow blood vessel, it'll block off the blood flow altogether in some cases. And if that blood vessel happens to feed your brain, you end up with a stroke. So you need to stop that. The other thing is alcohol use. If you drink excessively, you need to back it off because excessive alcohol use beyond moderate, and moderate alcohol use is considered to be one drink no more than 3 times a week of no more than 8 ounces. And they consider wine to be amongst that alcohol content, which is a low alcohol containing beverage. If you're drinking more than that, then when you stop drinking, you go through acute withdrawal. And one of the symptoms of acute withdrawal is your heart rate goes up and the blood vessels start to constrict, similar to what happens when you take a puff of a cigarette. It can increase your risk of having an occlusion to an artery. And if that artery is one of the cerebral arteries or one of the arteries in your brain, it can elicit a stroke. God bless you. I hope this has been informative. If it stirs up any questions for you, if you have other topics that you think that you want to discuss, go in and communicate it with me in the link below. If you haven't already subscribed, subscribe. If you think that this is a good topic and you're interested in it, hit that like button. Also hit that bell notification so that as we roll out new information, you can be among the first to hear about it.